Well, Tim, the odds are we will never have to talk about cancer again. A month earlier, they'd taken out the upper left lobe of my lung to remove a cancerous nodule. They confirmed it was stage 1 and got it all, but there had been some vascular invasion. Just to make sure, I would have to have a routine scan every 3 months for the next 2 years. 2 years to the day, at my routine checkup, I could tell something was different. The surgeon was spending more time chatting about our family and travel. I looked over at my wife, and we could both tell he was purposely taking his time before sharing the results. I can't describe my emotions as I walked out of the hospital that day. It was catastrophic. I attempted to tell our 4 children, but I couldn't speak. I had to leave the room as my wife shared the news. 11 nodules, likely stage 4. The diagnosis was confirmed with another surgery 3 months later to remove 2 of the nodules, and then the waiting began. I couldn't see an oncologist until I recovered from surgery, and I was left with no healthcare provider to speak with for 2.5 months. As I waited, and I wondering what treatments would look like, wondering how long I would have to live, wondering if my family would have to watch me die a terrible death. Everything I read on the internet described how horrific lung cancer was, and I was angry. I hadn't smoked, I was only 59, and it just wasn't fair. I had to become an expert researcher and search out everything for myself until eventually I was able to speak with another lung cancer patient. That conversation was the first glimmer of hope for my wife and I. To talk with someone who had been living well, despite her lung cancer diagnosis, began to change my mindset. That mindset was reinforced when I first met with my oncologist, and he never used the word terminal. He said it was non-curable, and I thought, okay, I guess I'll have to learn to live with this. A few months later, I was at a one-day event with Lung Cancer Canada to bring doctors and patients together. During a discussion, one doctor said, "We need more lung cancer patients to speak up." And one of the patients responded, "They're all dead. We're just starting to live and be able to speak up, but we need your help." Ever since that day, I decided to volunteer for many different projects, to speak up for the 78% of people who don't survive lung cancer, and the 22% that still need support and research to thrive, not just survive. Over the past 4 years of living with stage 4 lung cancer, my hope and optimism has grown for myself and for others who are diagnosed with lung cancer in the future. I've learned to live with the constraints of treatment, and my goal is to remain in that 22% and to increase that number. I've never spoken the words terminal cancer, and I never will. I have chronic lung cancer, and I hope that my experiences will help everyone in the cancer care system speak with each other differently now and in the future.